several people are said to have gathered in a deliberate attempt to acquire COVID-19 in order to develop post-infection immunity. The safest and best way to reach herd immunity for Albertans is to be vaccinated, plain and simple.
If she got the flu for 14 days, she's as protected as anybody can be, because the best vaccination is to get infected yourself.
And
so
if
she really has the flu, she definitely doesn't need a flu vaccine.
Since March of 2020, there has been a war on natural immunity that may finally be coming to an end. For Rebel News, I'm Tamara Ugolini, and it appears that the case for natural immunity being superior reigns in the latest publication by the New England Journal of Medicine. And it also looks like the injections may hinder that process, despite the reassurance from politicians and supposed health experts that they were for your own good. In this report, I'm going to highlight some of the findings from that study, again published in the New England Journal of Medicine, but I'm also going to show you just how coordinated and orchestrated the attack, the war really, on natural immunity was and has been for the better part of 2 years. The study is titled Effects of Vaccination and Previous Infection on Omicron Infections in Children. Surprisingly, didn't detail exactly what it found. The study itself was conducted on a large cohort of children over a 6-month period when the Omicron variant was dominant. The authors observed and reported on the protection conferred by Pfizer's BioNTech BNT162b2 vaccine and by previous SARS-CoV-2 infection against reinfection and coronavirus disease 2019 related hospitalization and death in children 5 to 11 years of age. Let's run through the numbers that they used. The study looked at a total of 887,193 children. Of that, there were 193,346 SARS-CoV-2 infections that occurred between March 11th, 2020 and June 3rd, 2022. Of the infected children, there were 309 known to be hospitalized and 7 were known to have died. Approximately 30% of the children included, a total of 273,157 participants, had received at least 1 dose of the Pfizer injections between November 1st, 2021 and June 3rd, 2022. The authors only detailed this as their finding, and I quote, "The rapid decline in protection against Omicron infection that was conferred by vaccination and previous infection provides support for booster vaccination." But the charts that they themselves show paint a much different picture. Let's dig in. Chart A shows the children who were vaccinated beginning in November. So the green line depicts those vaccinated in November, and the blue were those vaccinated in December, and so on. Both the green and blue lines go into negative space within 5 months of the first injection. Chart B represents vaccinated children who have not been previously infected, so that's the blue line, and those who had been previously infected, the red line. Again, these lines go into the negative on a steep decline within 5 months post-vaccination. Chart C and D is where it gets interesting. Chart D shows the effectiveness of natural immunity from previous infection among the vaccinated. The blue line denotes infection with the Delta variant. It still hits into the negative within 7 months post-vaccination. It's assumed that the red line would continue on a similar path of decline too. Now let's look at Chart C, which measured the effectiveness of previous infection against reinfection among unvaccinated children. Immunity wanes over time, but much more gradually. The blue line again is Delta, and even after 8 months, it still hovers above 50%. And look at that green line. Natural immunity is still well in positive territory after 16 months. Why do the vaccinated cohorts have protection that goes negative, even if they have natural immunity too? The mainstream media and our supposed experts told us that hybrid immunity, or just that gained from vaccination alone, was far superior to natural immunity. Look at, for instance, perpetual victim reporter Rachel Gilmore. She may have gotten her facts wrong in her September 2021 headline piece titled, "Fact Check. No, natural immunity doesn't replace vaccination, experts say." She inserts a clip of Dinahinshaw, Alberta's Chief Medical Officer of Health, and here is what she had to say.
Reports began circulating yesterday of an event where several people are said to have gathered in a deliberate attempt to acquire COVID-19 in order to develop post-infection immunity. What is important to know is that anyone contemplating this kind of activity should know that this consequence, severe illness, and transmitting to others who may become severely ill or even die, is an absolutely likely outcome. If anyone wants to get protection from infection, vaccines are free, highly effective, and easily available. The safest and best way to reach herd immunity for Albertans is to be vaccinated, plain and simple.
It was a recurring theme in the mainstream media last fall as they amplified the CDC's findings here.
CDC study suggests getting the vaccine will offer you much stronger immunity to COVID than natural immunity, meaning even if you previously had the virus, the vaccine will still offer better protection.
Well, Vicki, researchers looked at data from nearly 200 hospitals across the country to make this conclusion. Local doctors saying this study is good information for vaccine holdouts or people looking to gain immunity by simply getting sick with COVID-19. The latter, experts say, is very risky because it can lead to ending up in the hospital or worse, death.
Even in spite of data from Israel in August of 2021 that found natural immunity to be, again, superior to vaccine-induced, otherwise known as artificial immunity, the novel injection swindlers at City News worked hard to debunk that one.
Natural immunity has been a hot topic of conversation since researchers in Israel released a study in August comparing those who were vaccinated and those who had recovered from COVID. The researchers of the study concluded that natural immunity post-COVID gave longer-lasting and stronger protection against infection, symptomatic disease, and hospitalization. But a Mayo Clinic doctor and expert in plasma and antibodies, which fight against viruses like COVID, disagrees. As he explains it, when someone is exposed for the first time to either an infection or a vaccine, your body's immune system responds quickly, but it doesn't last. Therefore, a second vaccination is needed to create long-term immunity.
Up until now, natural immunity was always known to be superior than anything else. Fauci knew it then, but perhaps he needs this reminder.
But she's had the flu for 14 days. Should she get a flu shot?
Well, no. If she got the flu for 14 days, she's as protected as anybody can be because the best vaccination is to get infected yourself.
And
so
she should not get it?
If she really has the flu, she definitely doesn't need a flu vaccine. If she really has the flu,
she should not get it again.
No, she doesn't need it because it's the most potent vaccination is getting infected yourself.
This is an ongoing question, and we've had ever-evolving opinions from you, Dr. Fauci. Currently, antibody surveys show that 80% of children, approximately 80% of children, have had COVID, and yet there are no guidelines coming from you or anybody in the government to take into account their naturally acquired immunity. You seemed quite certain of yourself in 2004, but in 2022, there's a lot less certainty.
And the study confirms just that. Not only does it confirm the strength of natural immunity, it also paints a very alarming picture. Not only do these injections become negatively effective after a few short months, but they may very well destroy the protection that would have otherwise been garnered by natural immunity. For Rebel News, I'm Tamara Ugolini. As the science continues to evolve, it becomes clearer and clearer that forced boosters are unnecessary and unethical. It's why we've taken a stand against them at noforcedboosters.com. We've partnered with the registered Canadian charity called the Democracy Fund to litigate onboarded clients in defense of their civil liberties and freedom of medical choice. You can find out more about that active litigation and sign our petition at noforcedboosters.com.